morning, guys. Today I'm here to discuss about the studies that I have presented at ACSCO. Thanks to VR Neurology and all the team members involved in facilitating this event. So the study is all about the efficacy of glucagon-like peptide receptor 1 agonist for the prevention of stroke. A meta-analysis of randomized controlled trials in which we include patients with and without diabetes. We would like to disclose that there is no financial disclosure that any of the authors have disclosed and no conflict of interest involved in the study. Background: GLP-1 receptor agonists analogs are glucose-lowering medications for managing various types of cardiometabolic disease, including diabetes mellitus, obesity, and overweight. Glucagon-like peptide receptor agonist has shown to have a reduction in major adverse cardiovascular event in previous meta-analysis and even the randomized control trials in patients with type 2 diabetes. However, its efficacy on cerebrovascular event is not well established till date in diabetic and non-diabetic patients. So, we sought to evaluate the efficacy of GLP-1 receptor agonist in patients in prevention of stroke among patients with and without diabetes. Methodologies. So, we included studies from inspection till 15th July 2024, and our inclusion criteria was patients more than 18 years of age with all included randomized control trials and with having this two arms, one with GLP-1 intervention as an intervention group and placebo as a control group. These studies must have reported the outcome of interest, that is primary and secondary outcomes, which we will discuss later. Our exclusion criteria were studies performed on animals, reviews, case reports, and studies of single arms or without having outcome of interest. Our primary outcome was stroke, and secondary outcome was the risk of fatal stroke, non-fatal stroke, adverse events such as ischemic stroke, hemorrhagic stroke, embolic stroke, and cerebrovascular events. Statistical analysis: we performed a conventional meta-analysis from primary and secondary outcomes and adopted the Simeon and Laird random effect model for the study. The variance outcome were reported as a pool odds ratio and then corresponding 95% confidence interval. The statistical significance was met if the 95% confidence does not cross the numeric value 1 and two-tailed value of p less than 0.05 was considered statistical significance. Results: a pooled analysis of primary. A total of 11 studies were involved in the study in which GLP-1 RA group are having 43,339 patients and 42,000 patients approximately placebo group. The mean age of the GLP-1 RA group was 63.5 years and 63 years in the control group. The median follow-up duration was 2.1 years for the entire duration of the study. Pooled analysis of primary and secondary endpoints shows that GLP-1 RA significantly reduced the risk of stroke by 15% with the odds ratio of 0.05, 95% confidence interval 0.77 to 0.93, and p-value less than 0.001, and non-fatal stroke by 13% risk reduction with an odds ratio of 0.87, 95% confidence interval 0.79 to 0.95, and p-value less than 0.001 compared with the placebo. However, the risk of fatal stroke with odds ratio of 0.94 was found to be comparable between both the group of patients. Similarly, the risk of serious adverse events such as cerebrovascular accident, although showing non-significant association, but shows a non-significant reduction with a p-value of 0.75 and p-value of 0.05, and hemorrhagic stroke with a ratio of 0.82 and p-value of 0.57, and ischemic stroke with a odds ratio of 0.85 and p-value of 0.26, although found non-significant reduction, but shows a trend of reduction in favor of GLP-1 RS group. And this central illustration highlight the findings, and these are the baseline tables. Have all included studies of 11 clinical trials from Flow, Select, Excel, Harmony, Rewind, Pointer 6, Alexa, Leader, Sustain 6, Amplitude O, and rest of the others. And in conclusion, treatment with GLP-1 RA group agonist has a beneficial effect in reducing the risk of stroke and non-fatal stroke in patients without diabetes. However, no such effect was observed for fatal stroke. And the reason behind the uh, no such significant reduction found in fatal stroke is basically GLP-1 are associated with a reduction in the risk factors associated with the cardiovascular events, adverse cardiovascular event. Hence, a direct effect was found for a reduction in the cardiovascular events, and these risk factors play a role in reduction in the risk of stroke. However, the chronic stroke or any fatal strokes associated with mortality, we don't find any such association because these are like spontaneous, and the risk factors that involved are not going to be managed immediately by these drugs. Thank you.